Thank you everyone for being here. Today, we're going to be discussing some of HP Plus's experience working in stewardship, accountability, and transparency around the world. Over the last 7 years, HP Plus has taken a comprehensive view of health governance, starting with how we think about our stakeholders. These stakeholders are comprised of the state, the citizenry, community or general public, and providers at the national, subnational, and community level. While we aim to equip and support each of these groups of stakeholders to have full capacity and resources, they do not operate in a vacuum, and they must work together. This is what is commonly known as the health governance triangle, which is a good way to describe how we go about our work. We work to strengthen the state's ability to set the rules for providers and citizen engagement, and to be responsive to the needs of the public. We work with the community and civil society, or citizens here on this graphic, to advocate to the state and voice their needs and demands to providers. We work through policies and operating procedures to improve how providers deliver services to the public and improve their reporting to the state. HP Plus works across all of these areas as needed to advance country goals, as evidence shows that working in these areas can lead to improved health outcomes. Strengthening stewardship is a critical piece of sustainably improving health outcomes. HP Plus works with our country stakeholders and field teams to identify opportunities to either strengthen stewardship comprehensively or in a more specific way that is focused on one or more of the WHO-defined 6 stewardship functions. While stewardship activities and interventions are targeted at the state, they are all obviously intended to improve the state's ability to work with the other actors within a given health system. And our stewardship activities are designed to foster transparency and accountability throughout the system, especially when our stewardship work is complemented with our work with other health system stakeholders. Working together, this approach contributes to improved health outcomes, and we're able to adapt it for a variety of health issues and levels, including individuals, organizations, and systems. For example, when strengthening the relationship between the state and providers, some activities are quite specific. For example, developing and implementing national respectful care guidelines in India and improving FP data reporting and use in Uganda, while some are a bit broader, such as supporting the government to disseminate key health policies and strategies to providers in Madagascar. To support the relationship between the state and citizens, we work both at the state level to ensure state actors not only have the connections and platforms to hear from citizens, but understand the value of hearing from citizens. For example, in Cambodia, we supported the development of a policy framework that institutionalizes civil society engagement for HIV policies and programs. On the other hand, we work with citizens and civil society too. In Malawi, youth have been empowered to engage in the Global Financing Facility Task Force, and in Zambia and Tanzania, we work to scale up a collaborative commitment tracking mechanism developed by the Samasha Medical Foundation in Uganda. Between providers and citizens, we've worked to reduce stigmatizing and discriminating behaviors on the part of facilities towards those living with HIV in Ghana and Tanzania, strengthened engagement between providers and citizens to scale up HIV prevention, testing, treatment, and retention in Ghana, and supported local establishment of community and provider dialogues in Malawi, Nigeria, and Guatemala. And finally, we have some activities that address all 3 groups. Our CIP development and execution work strengthens relationships between all 3 groups during the development process, and execution further builds trust between them. Our joint accountability initiatives, which will be discussed during our Innovation Cafe tomorrow, bring all 3 groups together through an engaging and participatory process to strengthen accountability for a particular issue. And we have also linked citizens, the state, and providers at facility level to improve the FPRH supply chain in Tanzania. I'm very excited about our group of presenters today. First, Paul Richard of Madagascar will talk to us about how we have leveraged and strengthened stewardship to achieve a demographic dividend in Madagascar. Then we will turn to a video from our Ugandan colleague Moses from the Samasha Medical Foundation to share with us about his organization's experience strengthening accountability from the civil society perspective. Then we'll hear from Armenia, who will tell us about the Guatemala team's experience improving accountability and transparency around health sector financing. We'll then hear from David from USAID to share his thoughts on how governance can help sustainably achieve health sector outcomes, as well as the spillover effects of strong health governance. Finally, we'll end with a moderated discussion. Thank you again for joining us today. And with that, I'll turn it over to my colleague, Paul Richard.
You understand that HP Plus project in Madagascar is implemented for 7 years, and its objective focus on 3 topics. The first one is to end preventable maternal and child deaths, for which the main intervention is to strengthen health sector policies and strategies, such as national health policy and its strategic plan, community health policy and its strategic plan. The second is to secure access to healthcare and financial protection, for which the main intervention is to support sustainable health financing mechanisms, such as National Health Financing Strategy, Toolkit for Health Solidarity Fund for implementing universal health coverage, investment case for reproductive, maternal, neonatal, child, adolescent health and nutrition. The third is to address unmet need for family planning, for which the main intervention is to strengthen the legal and regulatory environment for reproductive health and family planning, such as the new Reproductive Health and Family Planning Law and its application decree, especially for contraceptive detection, costed implementation plan for family planning, and finally, roadmap for implementing and monitoring the demographic dividend. The demographic dividend concept was used to convince first the demographic dividend team, the DEMDIV team, for the importance of the demographic dividend for economic growth, and used next to convince the government of Madagascar to adopt the changes in demographic and economic policies and committing to support demographic dividend activities. Changing the population structure and reducing the dependency ratio will have positive effects on the 4 pillars of the demographic dividend: health, economy, governance, and education, and lead to increased economic growth. So, attaining the demographic dividend requires combining policy reforms, such as strengthen human capital, education, health, family planning, reducing total fertility rate, economic reform, governance, employment, including women's empowerment and significant participation in the workforce. Next slide. In the graph, this model shows the impact of achieving the demographic dividend on GDP per capita. If we keep the status quo, no new investment in these areas, the effect is shown by the blue line at the bottom. Investing just in the economy, you can see the significant increase shown by the green line. Investing both in economy and education, there is an even greater increase shown by the yellow line. But investing in economy, education, and family planning, we see the greatest increase and the full achievement of the demographic dividend shown by the red line at the top. So, HP Plus provides the technical assistance to train stakeholders to apply HP Plus DEMDIV model to the context of Madagascar. Then, HP Plus helped to create the multi-sectoral national demographic dividend team, DEMDIV team. Building this multi-sectoral coalition of partners was a major accomplishment. Achieving the demographic dividend requires the engagement of all of these stakeholders, spanning all 4 pillars: health, economy, education, governance. Members include 7 ministries: economy and finance, public health, education, population, labor, youth and sport, and justice, including civil society and private sector also. HP Plus supported the Ministry of Economy and Finance, MEF, especially the Directorate of Planning, to provide leadership of the DEMDIV team. The MEF is committed to a particular and strong role for the inclusion of the demographic dividend within the President's emergency plan for Madagascar. HP Plus has facilitated 3 capacity strengthening trainings on advocacy using the AFP SMART method, strengthening stewardship, leadership, and advocacy skills was necessary to enhance the coordination between these multi-sectoral stakeholders and to help officials develop and implement policies to achieve the demographic dividend. So HP Plus supported the MEF stewardship to implement recommendations based on findings from the DMDIV model application, such as the need to develop an implementation roadmap. HP Plus helped then the DMDIV team to develop the demographic dividend roadmap, which defines sector-specific milestones and indicators, and it was launched in 2019. With HP Plus support, stakeholders use data generated using the DMDIV model to formulate a strategic policy direction. HP Plus later supported ministry leaders to budget the roadmap, calculating costs to achieve objectives in each sector. This is important for ensuring that the plan is feasible and adapted to Madagascar's context. During a high-level roundtable in March 2020, all 7 ministries signed an official commitment to implement the roadmap, demonstrating their stewardship capacity for multi-sectoral engagement and coordination. That was thanks to the MEF's leadership. Thus, the DMDIV team is continuing its leadership through the roadmap's monitoring and implementation plan. This strategic and actionable plan gives all stakeholders a clear understanding of their roles and responsibilities for implementation. The plan outlines indicators for all 7 ministries to monitor, and this will reinforce accountability and ensure effective implementation. Defining specific and measurable indicators is a foundation for accountability. Performance will be carefully monitored in each sector to ensure that objectives are being achieved. Key indicators and costs for each sector were incorporated into the President's Plan Emergence for Madagascar, thanks to MEF leadership and the DMDIV team advocacy. Madagascar's President has expressed his strong support for efforts to achieve the demographic dividend and the importance of family planning. So that's all. Thanks a lot for listening. Thank you.
Samasha is known for the motion tracker. And this came out of a realization that the FP 2020 commitments that countries made in 2012 at the London Summit had sort of lost traction. And the reason for losing traction is because civil society organizations had not completely understood the commitments. Most civil society organizations had actually not read the commitments, but we were having mainly updates from the FP 2020 Secretariat about the core indicators. And so from a civil society perspective and accountability area, we felt that we needed to create a tool, not actually a tool, but an approach that will help civil society organizations, 1, to understand the commitments, 2, to develop indicators for tracking the commitments, and 3, create a neutral space where all civil society, government, and development partners can come together, discuss progress. But the fourth component of the motion tracker is that civil society organizations contribute to the achievement of the commitments. And so we created this approach and piloted it in Uganda, and actually all our assumptions were met. But the motion track took off when we got support from the HP Plus, and I'm very glad and thankful for Alison, who knew and understood the motion tracker, who knew and understood the accountability approaches, and we got support from USAID HP Plus to scale up and see whether the motion tracker can work in other countries. We chose Tanzania and Zambia, and within these countries, we did not go as Samasha to go and implement the motion tracker, but our approach was to build capacity for civil society organizations within that country to implement the motion tracker. And it was really a success, because in Zambia and Tanzania, we recorded a number of successes in terms of budget allocations, in terms of policies, and those were all the process indicators that were developed through the consensus meetings, the stakeholder meetings with the neutral convener within the different countries. In 2016, HP Plus built capacity for SAMASHA to undertake joint accountability. Now, the joint accountability approach is really an approach that studies the accountability relationships between individuals or actors, and then develop action plan to address the deficiencies within the accountability players. In Uganda, it was piloted among women leaders, and it was successfully implemented in a district called Iganga. But based on those lessons, coming forward to 2019, coming forward to 2021, SAMASHA had got a contract to implement and activate the motion tracker within the Ouagadougou Partnership countries, Niger, Senegal, and Benin. And at that time, in 2021, countries were preparing to start developing the FP 2030 commitments, and they were deconstructing the commitments, trying to understand the commitments. And we felt that during that same period, the joint accountability approach could be used to ensure that the accountability shortcomings can be identified within those three countries and action taken. One of the examples is that in Niger, the adolescent and young people had issues of weak coordination, which was identified within using the joint accountability approach. And the self-appointed youth and adolescents went around the country and really documented the civil society organizations in the country, and came together and developed what we call the action plans. And those action plans really have been followed through. And right now, as we talk, in Niger, the adolescent and youth civil society organizations have really strengthened their networks. They have strengthened their coordination by using of a joint accountability approach, where each civil society organization is accountable to each other, and those are the pairs of accountabilities. The joint accountability approach comes out of the Brinkerhoff paper, and I think some of us can read that paper. It's a wonderful paper. In terms of a motion track success, the motion tracker in 2019, we started with the 93 countries that were actually following up on the commitments in the countries where we are implementing motion tracker. But now we are looking at 255 civil society organizations that are actually contributing and reporting on commitments. The other aspect of motion tracker that we really pride in is that it's scalable in terms of geography and also in terms of interventions. One of the lessons that we've learned from USAID HP Plus support is that advocacy and accountability requires resources and also trust within the local organizations that understand the local environment and the local context to be able to drive action and galvanize everyone around. So as we move into the FP 2030 arena, we are looking at how local civil society organizations, indigenous civil society organizations can support the hubs in the areas of advocacy, in driving FP 2030 commitments, and ensuring that there's action, visibility, and leading to more mutual accountability for FP 2030 commitments. So thank you.
substantially as a result of the strategy developed to improve governance, transparency, and accountability. When HP Plus started, the Ministry of Health has a strong link with unpaid cumulative debt. This was the result of the lack of transparency on managing the public funds. Our first job was negotiating with the Ministry of Finance the debt relief and refunding health services to recover coverage rates. Then, we found the public funds transferred to local governments for health, education, or another human development goals were used only for public works. And there was no accountability associated to the use of those funds. This opened the door for bribery and kickback commissions. To address this issue, we worked with the President's Secretariats and Ministry of Finance to set priorities for local investment in human development. Funding allocated improved, but the execution of funds was very low. So we searched for solution on transparency and accountability and those include, number one, a regulatory framework for the use of the funds. Number two, municipal policies to improve the community health outcomes. 3, standards for health infrastructure development projects. 4, an automated public online systems to ensure health infrastructure project application compliance with defined standards and transparency in project approvals. And number 5, the concentrate the review and approval of municipal wash projects. The execution of funds increased from 88% to 98% in the past 5 years. Every recommendation issued by HP Plus involved close conversation with all partners. We supported many government agencies and both at national and local levels to build alliance to increase transparency and accountability. The first step was to create an interagency technical working group to regulate and audit financial resources transferred to local governments. To increase the priority of health responses local level, HP Plus introduced the promotion of municipal policies enacted by Municipal Development Council, which are participatory spaces. These municipal policies provide a vision to build healthy communities with intersectoral intervention. This approach worked well for urban and metropolitan municipalities, but not so the most rural communities, where the immediate challenge was the lack of adequate health care facilities, staff, and supplies. While municipal investment have increased over the last 20 years, the new health facilities were not approved by the Ministry of Health because they did not meet regulation and specification, which hadn't been coded yet. Therefore, HP Plus provide technical assistance to Ministry of Health to develop a guide to local government investment on health facilities. Since its publication, the guide made possible a step increase in municipal investment in health infrastructure. However, many projects were rejected or not approved in time to be funded within the calendar budget cycle. The process was unclear, unregulated, not transparent, and required constant travel to the capital city. With all this red tape, it enabled bribery here and there. The project advocated for the development of an online system to submit project proposal and upload requirement documentation. The system received 1,000 requests during the first month, and the number of registered, assessed, and approved projects continues to increase. It is important to mention that perhaps because of the pandemic lockdowns and travel restriction, people embrace the online system. The overwhelming wave of online requests resulted in a backlog of applications needing approval from the Ministry of Health. Due to the backlog, the President, the Congress, the Development Council, and the media started to put pressure on the minister. With the new challenge, HP Plus provide technical assistance to the creation of the decentralization watch offices to expedite approval process, thus increasing the Ministry of Health accountability to municipal application. The history continues. Along with policy intervention, we also prepared the municipal investment dashboard displayed here, which illustrates the amount of financial resources transferred to municipalities and development councils since 2000, and under what priorities those funds are used. For example, for health and nutrition, to benefit women and children, for wash, etc. The tool will increase transparency by providing civil society organizations with data to compare the previously priorities of the Municipal Development Council with the actual funding allocation. This financial tool has been instrumental to convince the Congress to review the constitutional transfer methodology used for distribute funds in a more equitable manner. And it also limits spending on issues that do not benefit the communities. The tool has also helped identify changes over time in investment in health, education, wash, food and nutrition, among others. In February 2022, the President of Guatemala gave awards to municipalities in the top 20% of those that improve the efficiency of transferred federal funds for health projects. The specific secretariat select award winners, identifying the municipalities that appropriately invest 90 to 95% of its the Development Council funds. The recognition of this efficient spending by municipal government by the Secretariat of the President demonstrate the increased priorities for health investment, and is a sharp contrast with the less transparent situation HP Plus found in 2016. I will sum up. A few of the main lessons learned from this process. First, developing a regulatory framework, a budget execution methodology, and training of all executive units was a crucial first step to improve governance and transparency. Second, the tools, the dialogue space, and the online dashboard are important enablers for increased transparency and accountability of public administration of funds, which should be paid with years of efficient and strategic investment in community health, nutrition, education, water, and sanitation, where it is most needed. For example, resources were mobilized toward indigenous mothers and children from rural communities of the Western Highlands, where maternal, neonatal, and infant deaths are higher, where opportunities for the youth are limited, and where incentives for irregular migration are higher. As Richard Buckminster used to say, you never change things by fighting the existing reality. To change something, build a new model that makes the existing model obsolete. Therefore, the new locally led model, in which we have been working with our partners, will do just that. However, We recognize that a journey of 1,000 miles starts with a single step. This is just one step, one initiative in our journey toward the more transparency and an equitable Guatemala. Thank you to USA, Palladium, and HP Plus for letting us to be part of this significant step for our developed country. Thank you.
Thank you. Those are some excellent presentations and a tough act to follow. So I'll speak a little bit about the view from the Democracy, Human Rights, and Governance Center about how we look at a project like HP Plus and integrating DRG with health and other sectors. Thanks for inviting me to be here today. So just giving a little bit of the story of the background from the DRG perspective of kind of looking at integration and how do we think about questions of things like governance and accountability in other sectors. The original kind of rationale that was come up with was very much instrumental, that if you improve how sectors are governed, if you improve accountability, this will contribute to more sustained outcomes in those sectors, which I very much believe to be true, and we've heard some good examples of where that holds. But I think one of the things that has happened more recently, particularly with COVID, is a recognition that you can't really isolate these things, that health status in light of a global pandemic is as dependent on civic trust or the quality of information or disinformation as it is on the health system itself. And so looking at it as kind of just, how can governance be one component of a health system misses a larger societal reality of how a well-governed society and a healthy society interrelate at multiple levels. I think also we're now seeing, under this administration, more attention to kind of the fabric of democratic societies, to questions of what makes a democracy resilient, and looking at work to improve something like health governance as an aspect of helping an overall society be more resilient to shocks, be more able to capitalize on opportunities. So it's a kind of different standpoint, and starting to see that feed into some of the areas of integration. So having worked on this now for a number of years, one of the questions that we always get asked is, what is it that contributes to effectiveness? How do you improve governance in sectors? And are there things from a DRG perspective that you can bring? And as a first point, I would just say, actually, I think we have a lot more learning to do from folks working in health than you have to do learning from us. We've heard some outstanding examples throughout the course of this event of the work of HP Plus, and I think just recognizing how much, while your focus may have been on health, those have been meaningful governance improvements is important. One of the questions I always get asked is, what do you think of citizen report cards, or this type of social audit, or all of these different tools? And I think for me, maybe the biggest takeaway I've seen from what has worked is that it's not a question of tools. That really it's about approaches, it's about processes, it's about, as has been said repeatedly over the last few panels, the kind of long-term engagement and trust building. And so this requires, not only some space within programming to be learning and adaptive, to do things like co-creation, but really an emphasis on that learning as meaningful. And I think that's one of the areas to potentially see some shift is elevating that a little bit and starting to view that not as the precursor or the permission to do meaningful health governance work, but actually as an important piece of the real work going forward. Something like relationships. There's a lot of evidence out there now that who you know matters much more than what you know for things getting done. And yet we still treat the accrual of relationships over time as a nice byproduct of the work, or as something where if you have a particularly skilled chief of party, they bring some relationships with them that will allow us to get to work. And we somehow miss the idea that actually weaving those threads and building those relationships is work that can, with a great deal of confidence, and evidence behind it, be expected to lead to better outcomes in the future. I think also there's room for more sharpness around incentives. I think we've heard it talked about, I hear it in what Armenia is saying about the way the online database was used, and a kind of deeper sense of accountability there. That it's not, well, then we will make transparent who's been spending their money how they should so that we can say gotcha. But that it's much more, well, then we will start to have the data needed for different groups, for the civil society folks in Uganda, for the coalitions of actors in a multi-sectoral partnership to come together and put the right type of pressure on government to do something different. But I think understanding that requires perhaps surfacing more what are the real political economies of what's going on. Somebody is winning from the status quo. Who's going to win and lose from the change we're suggesting? And being a little more comfortable saying that that is going to inform some of the choices around which reforms and how. And then I think really for me this is kind of the big takeaway going into where I hope this integration space will move in the next several years, which is kind of zooming out away from the value of an activity. If someone is going to tell a story about something like the transformation of Madagascar towards realizing its demographic dividend 20 years from now, and they look back at what was done in, say, 2023 to 2024, it's not going to be a specific policy that got passed. It's not going to be a specific training. It's going to be that the value of those change efforts was much less, and the value of the champions that they enabled was much higher. It's one of the things I really find beautiful about HP Plus is the extent to which you very naturally, through this project, have gravitated to identifying champions and really supporting them and taking the time. I like the description of the co-creation, as that Modibo gave us, as that's what you need your implementer for. It's not something to take out of the way and get done government to government. It's actually this kind of lubricating that space is what a savvy implementer does. But I think this has questions for us. If we think savvier investments are working on shifting norms in the society, building relationships, figuring out how to build in the learning by doing, what does that mean if you were telling that story 20 years from now, you would have wanted to see done in these next 2 years? What should we be looking at as the right indicators? Not perhaps to replace the ultimate outcome indicators that frame our strategies, but at a tactical level, what would be some of the things that we would say, okay, now major progress is twice as likely in 5 years as it was because we have established this platform, because we have built these relationships, that type of thing. I think we need to start to put some of those more in the center and understand them as core to the work of improving health governance. And I think we're fortunate that we have a deep reservoir of experience and expertise from HP Plus that can really give examples of what that looks like in practice. And I think we just need to, at USAID, get better at recognizing it and seeing it as such. So, thank you all very much, and I'm looking forward to
Well, I'd first like to thank all of our presenters. I really appreciated your effort and your words. So I could very easily take up like 500 hours with these individuals and pick their brains and listen to what they have to offer. I'd like to see if there are questions in the audience. I'll give you all a chance. If I don't see any hands pop up, I'm going to start, and then it may just roll, and then y'all might be in trouble. But, okay, so for both Madagascar and Guatemala, we've seen that sustainability is a common thread. And I'm wondering if you each can take a moment, when you are thinking about sustainability of governance interventions, what are those key measures of success that you're looking for that David was just alluding to? Rita, would you like to start?
Okay, thank you for the question. For us, the sustainability of governance intervention, the key measure of success is our approach to sustainability starts with legitimacy. The second is the ownership is essential to sustainability. The tools need to be useful and compatible and scalable. We measure success in sustainability when organizations provide the staff and funding based on the ownership and legal mandate. This is, I think, this is the key measure that we consider when we work.
Thank you. Parajar?
Okay. I'm sorry, I'm francophone. It's more easier for me to talk in French for discussion and the clarification. Ok? Je sais que cette question est très pertinente pour Madagascar, parce que le défi là-bas, c'est surtout actuellement les changements institutionnels fréquents. Et depuis que d'ici que j'étais avec HP+, et quelques temps avant, on a connu vraiment 5 ministres de la Santé et puis 6 secrétaires généraux. Okay, you can translate?
Please, everyone, welcome Mackenzie Scott. So this is a very relevant question for Madagascar, very important, because one of the key challenges that we face in Madagascar is the frequent institutional change in government. So just through the length of the HP Plus project, we've seen 5 different ministers of health and 6 different secretary generals. So this is something that we definitely face often.
Thank you. Donc l'action pour cette durabilité, normalement, c'est de tendre vers la création d'une mémoire institutionnelle. Et comme David a dit tout à l'heure, c'est vraiment identifier les champions qui peuvent être là, malgré les changements. Donc il ne faut pas trop aller politicienne en haut là-bas, mais trouver les champions à un niveau intermédiaire, champions locaux même, si c'est possible. Et le process, c'est surtout aussi d'officialiser les documents politiques et stratégiques. Essayer d'officialiser avec ce qui est là. Et quand c'est officialisé, ça va rester quand même.
So one of the most important actions for sustainability is to foster institutional memory. And as David was saying, it's very important to identify champions, local champions wherever possible. Rather than investing specifically in particular politicians who may leave their positions, it's important to have those local champions who will endure beyond the life of a certain politician's tenure. So the other part of that is to be able to formalize strategic and political documents and policy documents so that they remain in place even beyond politicians' tenure.
Ok, et puis après, donc, ces documents, il faut officialiser, il faut les diffuser et les faire approprier à chaque niveau. Il y a le niveau central, bien sûr, mais après, il y a le régional, district, et puis juste à la périphérie, la primary healthcare. Chacun prend sa part dans ces stratégies qui sont définies et politiques. Donc, c'est un peu comme ça aussi avec le dividende démographique. J'en ai parlé tout à l'heure. Il y a toujours le plan de mise en œuvre et le plan de suivi.
So after institutionalizing and formalizing these policy and strategic documents, the second key element is to make sure to disseminate those documents at all levels of the health system and ensure that each level really feels a sense of ownership over the document. So from the national level to the regional level to the district level and even to the community level, it's important that each level is able to take ownership of those documents. And so as Parajar mentioned earlier with the demographic dividend, currently we're working towards an implementation and monitoring plan for ensuring the achievement of the demographic dividend. So that's an example of policy we need to disseminate.
Donc c'est plus facile pour moi d'expliquer pour la santé, par exemple, là, où votre question était surtout plusieurs secteurs, mais un modèle pour le ministère de la Santé, par exemple, il faut que cette action se poursuive itérative entre le niveau central et le niveau périphérique. Le central définit les politiques, stratégies, etc. Et puis après, la mise en œuvre, Et à partir de la base, c'est eux qui identifient les problèmes et les propositions des solutions. Donc c'est itératif, ça monte, ça descend, ça monte, ça descend. Et le processus continue, c'est ça la durabilité pour moi.
So sustainability for Paul Richard, he was saying that it should really be an iterative process from the top to the bottom and then back up again from the bottom to the top. So at the top level, the central level of government, that's where really the direction is determined for these policies, these strategies. And then at the very local levels, that's where problems are identified and where solutions are determined. And so there has to be that back and forth between the top and the bottom.
C'est le niveau local là, qui donne des résultats en général. Ce n'est pas les grands politiciens, tout c'est le niveau périphérique, Health Care Delivery. Mais il faut que ce soit les périphériques qui nourrissent les périphériques, les centrales, pour améliorer les stratégies, et puis c'est le processus continu. C'est toujours comme ça, mais il faut bien définir les indicateurs de performance appropriables par chaque niveau. Ils se retrouvent là-dedans. Et puis ils seront motivés pour dire que moi j'ai contribué pour ce résultat avec ces product, effect, impact, etc. C'est un peu ça.
So really, results are achieved at the local level. It's not with big politicians often. It's really at the local level, at the service delivery level. And so it's important that that's a continuous process of communication between the local levels and the national level. And it's also important that we define indicators that define performance and progress so that the implementing levels have a way to measure and track their performance.
Mais j'ai vu, finalement, j'ai vu ce que tu as présenté tout à l'heure, mais je suis passionné, je m'excuse. Il a dit, no tools, but approaches and process. C'est ce qu'il a dit, que j'ai vu. Hein. Et donc, c'est pour moi, l'équipe HPP, c'est petit. Hein. On ne peut pas aller partout. Donc, il faut définir les approches et les process. Mais pour diffuser ça, il faut les outils quand même pour diffuser. Mais il faut que les gens comprennent les choses. Hein. Je ne suis pas contre, mais je complimente. Merci. Thank you.
So he's referring to what David said earlier about not focusing so much on tools, but on approaches and processes. And I think we're really on the same page. But he wants to clarify that we're a small team, HP Plus, especially HP Plus Madagascar, and so we can't be everywhere all at once. So it's important to define approaches and processes, but also to have tools that we can use to then implement when we can't be everywhere. That aligns.
I think we prepared 2 presentations for our So, David, as a follow-up, we've been talking a lot both about institutions, but also about these relationships and trust between actors and how that contributes to sustainability. And so with USAID's continued focus on localization and locally led development, how do you draw the link between these types of achievements around relationships and trust with sector, with sector-specific outcomes?
So that's a great question and not easily answered.
You have 30 seconds, go on.
Sector-specific outcomes are, what I would say is it's the space in between, right? The outcomes are high level, they're strategic. We know we need, to see, population health statistics arrive at certain levels. But if you are saying what's going to give me confidence that that will be there, a vibrant multi-sectoral platform, a civil society that has not only learned how to use a particular tool, but has adapted it themselves and made some improvements to it and taken ownership of it, a set of mayors who are talking to each other about what they're doing in their municipalities. Those are the types of things that I think rightfully would give one confidence that we're going to see the strategic objectives obtained. Probably even more than just seeing some stepwise small change in, WASH statistics or something in a given geography. So I think the challenge is how to put together good and different theories of change that make that work essential to where we want strategically to go, so that we can then say getting this far is meaningful or is not. And I think we need to be ruthless about that and say sometimes you have a big dialogue, conversation, and everybody shakes everybody's hand, but it has not moved the needle at all on whether we're going to be able to do something. How do you tell the difference? That's something we need to be clearer at being able to describe, because we know that's what the work is, but we need to be able to distinguish it.
Thank you. I think we've got time for a couple of questions from the audience. A perennial question asker.
When the hands don't go up, I'm like, okay. Yeah, my name is Kerry Johnson. Thank you very much. This is about marginalized populations like key populations, and the question is, I totally hear this about the meaningful community engagement. I totally hear about the partnerships. But what do you do and what do you advise around when you have a government and you have policies that actually don't support the very communities that are actually in most need for these health services or governance services? So how do you reconcile? So I'm thinking, for example, around West Africa, they've signed on to regional documents, they all recognize the epidemiology of HIV, it's mostly affecting key populations, but there's so many strictures and barriers in place that really create barriers, not the least of which are political barriers for people to do meaningful interventions for KPs there. So you can maybe talk about how you would recommend to actually provide meaningful interventions that involve all these stakeholders and truly get at the needs of these communities. Thanks.
Thank you, Roshan. Can you help us? David's going to interpret for you.
Interpreta la pregunta.
Okay, thank you.
Un gusto. Hace una pregunta sobre el tema de poblaciones marginadas y el involucramiento de comunidades. Entonces la pregunta es, ¿qué hacer y cómo hacer cuando el gobierno o las políticas públicas no apoyan la entrega de servicios?
¿No apoyan la entrega de servicios?
La entrega de servicios.
Okay. As we talk during the lunch, in this case, for us, the civil society is the main actor. In our experience, when the community don't receive the services, the community demand the services based on evidence. For example, if we have if they have problems with the health services at the community level, they monitor the services and demonstrate that the lack of supplies, staff, etc., and use the evidence to demand the services, using the evidence as the tool to say you are not accomplished with your commitment with my community. And it's important, or has been important, that civil society understand at what level they need to put the demands. Identify what is the role at the municipal level, what is the role, who is the responsible at different levels, and in this case, they address the demand to the right level. And in Guatemala's case, the civil society had agreements signed with the minister, with departmental authorities, and with local authorities, and use these tools of this agreement to demand the accomplishment of the obligation of the authorities. Yeah.
Thank you. Would you like to add anything?
Oui, ok. J'ai bien compris, oui. J'ai bien compris la question, c'est comment atteindre les communautés quand les gouvernements sont en difficulté. Bon, les gouvernements peuvent être en difficulté, comme les crises. À Madagascar, il y avait aussi des crises. Donc là, on doit se tourner vers la complémentarité entre le gouvernement et les sociétés civiles et les NGO. C'est ce qu'a fait le SAD avant, quand le gouvernement n'est pas reconnu, donc on doit aller par là. Et puis les partenaires font on dit ça, filets de sécurité au nom de comment on dit ça, au nom de l'humanité, quoi, les actions humanitaires. Mais bon, on essaie toujours, mais quand le gouvernement est normal, comme j'ai dit tout à l'heure, il faut toujours une complémentarité entre ces deux, parce que entre les Civic Society et les ONG et le gouvernement, parce que souvent le gouvernement n'atteint pas toutes les aires, les remote areas, etc. Donc il faut cultiver cette complémentarité entre les deux. Je me souviens de Shradi, notre président tout à l'heure. C'est bien. C'est ça l'approche qu'on doit soutenir. Mais souvent, les actions des NGO et des civil society n'est pas pérenne si ce n'est pas intégré dans le niveau national. Donc cette complémentarité est vraiment la durabilité, comme Alison a dit.
So, government can often be a difficult thing, and in Madagascar, it can certainly be a challenge, and also crises that Madagascar is facing, including famine and natural disasters, etc. So the approach that Paul Richard suggests is to focus on complementarity between government, civil society, non-governmental organizations in the country. And so USAID has done this in the past and has really focused on this approach. Especially in terms of humanitarian action. And so it's important to emphasize that the government can't reach everyone, can't do everything, especially in very remote rural areas. And so that's where CSOs and NGOs can really complement their actions. But at the same time, CSO and NGO actions and activities will not necessarily be sustainable if they're not institutionalized or funded perhaps at the national level. So that complementarity is important.
Great. Well, thank you. I think we are out of time, if I understand my timekeeper right. But I want to thank you all for your remarks. And just to follow up, I think this kind of hit on a key approach of HP+, which is bringing just everyone together, finding those areas of complementarity to build that trust to address those difficult issues together. So I want to, oh, yes?
Yeah, just to respond to his question.
Oh. Thanks to help you. To help us.
The question was about like policies are not responding to, or they're really not good, like equitable policies and all those things, right? So the way we look at, as everybody mentioned, evidence-informed policies. So when you're looking at data, really understanding context, understanding problems, issues, looking at different segments of the population, gender data, all of that, that gives you information. And then when we are developing policies, it's not just enough to say, because you have seen many policies that say, oh, a lot of people are poor, we are very concerned, whatever. That's not the case. You need to have specific equity-based indicators. So if you are talking about reaching marginalized populations or the poor, you need to have set goals and indicators, what you're trying to achieve. And then you need to have specific strategies, approaches, all of that, how you're going to achieve it. And then who is accountable, how you're going to measure you're making progress, and who is accountable for it. So that's why when we have with the policies, these are some of the really important aspects. When I was talking about 187 policies, I was saying they're gender responsive, they're equitable, they really address, make sure there are accountability and transparency mechanisms. It's part of it, how we are going to monitor policy implementation. So there are so many different aspects, but I 100% agree. And policies can also have unintended impact on these populations. Sometimes, like best of intentions, you design something, and then when you start implementation, it will have impact which you don't want to. Like for example, sometimes we used to say free services for everybody. Who's getting those free services? Is the poor, people living in remote rural areas? No. So all of those things, I think we need to make sure that we continue to look at what kind of impact these policies have, and we always talk about pulse of policies like it's an iterative process, you continue to look at, you make changes, if things are working, not working, why they're not working, and what kind of impact it is having. So there's so many things can be done, but I just wanted to answer.
Thank you.
Thank you.